Hey Preceptors, I hope you guys are off to a good work week. We are here in week 6 already of the semester for the fall 2019 semester. So hopefully this semester is progressing and going well and smoothly. We don't have too many updates here on our front from program wise. So I'm going to give you a breakdown of what's going on in the students' courses and then always give you some little updates, and then we'll end with our teaching tip. So our first year students are progressing through their assessment course as usual. Foot and ankle are done, they're on the knee, and I believe they're moving on to the hip. So again, implementing those things as can, taking histories, doing evaluations for body parts they fully completed, palpations, practicing special tests. Any way you can implement those experiences would be extremely beneficial. When they're in the class, they get to do them one chance, so any way they can do that more would be beneficial. In therapeutic interventions, they are done with inflammatory response, healing, RICEs and how that influences immediate and acute care, and we are moving on to pain this week. So a great way to kind of maybe bridge the concepts between those courses would be maybe an evaluation's done on an acute injury. They kind of do that diagnosis, and then you can talk about, all right, so what's going on at the healing level, what inflammatory response, if one is present, how do we take those things into consideration when we're selecting therapeutic interventions to address their plan of care. So bridging those gaps. And that's also a time for you guys to be open and receptive to hearing what they have to say or revisiting some of those topics, right? Because we might not have actually, been paying close attention to them recently as we get into our clinical practice. Sometimes we kind of forget those components of the stages of healing and what happens at the cellular level with response. In regards to their integrative courses, they just finished a taping presentation and they covered heat illness. And they did competencies on heat illness, so maybe asking, hey, how'd your heat illness comp go? What did you well? What did you need to improve on? And then maybe exposing or going over concepts related to that. They will be moving on to skin or dermatological concerns, and they will be then doing emergency action planning in that course. So don't be surprised if those concepts come up. Second years, in their organization administration class, they've been working on a financial budget and a needs assessment. They are actually doing that for our athletic training facility here at the educational level, and they're presenting that tomorrow in class. So maybe ask them, hey, how did your presentation go? What did you learn? What were you surprised by? And then, saying they might actually look to you and say, what's your budget? How do you navigate those things and to kind of apply those concepts? They're then also working on facility design. So they might also be coming to you to saying, like, if you could, what are some things that you must have or you have to have, or if you could redesign this facility, what would you want? So don't be surprised if they contact you about that, or you could even initiate discussion related to that. In evidence-based practice, we conducted how to do literature searches more effectively. And then we did disablement models, healthcare informatics, and PROMs, or patient-related outcome measures. So for some of us, disablement models, healthcare, PROMs, those might be things that we do in our everyday practice, but that might not be that way depending on the setting that we're working in. So these might be new concepts for you, but they might not be new concepts for you. So I think this would be a really great time where you could be open and receptive to learning from your student. Maybe you don't know much about disablement models. Maybe you don't even really know what healthcare informatics is, or you know what PROMs are, but you really don't implement them into your patient care. So engaging in those conversations or asking the students, hey, teach me. What do you know? Because I need to be updated as well. And or maybe you are informed about those things, but you don't do them in your setting. Tell them why, because it's probably the nature of the setting is the reason why you maybe can't implement them. So having those conversations are important, because sometimes the students think that everything is necessary, and sometimes it's not necessary depending on the environment, the context that we're working in. So it's good for them to understand that. In their integrative class, we are doing concussion and spine evaluations, more kind of on-field and then off-field. Give them time to practice those. We're going to be doing simulations in class this week, but they need a lot of practice because their comp is going to be quickly following that. So probably over the next 2 weeks, they're going to be preparing to do their competency related to a concussion or spine evaluation that's kind of acute or on the field. So anytime you can go ahead and give to maybe do a mock scenario or something related to that would be beneficial. That's kind of the content in the courses. I'm going to be contacting you guys soon to schedule a site visit. So if you're an active site, I like to stop out at least once a semester and say hey and just kind of check out and see how things are going. For some of you, I will contact you first to organize that based on the nature of your environment. For some of you, I might speak to the student first and kind of say, hey, when are you there? Does this work? And I might talk to them about getting a date and time and then reach out with you to confirm that. So just watch for those emails and that information so I can schedule those and come out and see you guys and see how great things are going. Update from accreditation. So tomorrow, our self-study is due. So that's super, super exciting. We are one of 8 programs in the nation to write to the new standards, and that is due tomorrow. It has been quite the undertaking, but we are excited to kind of have that done. So with that in mind, our timeline. So that is submitted, and so then the site team, for Katie's site team, will start reviewing those documents. So don't be surprised if we contact you and say, hey, we need this information. We need a really quick turnaround on this. Katie's asking for it. We might get some of that in the next upcoming months. So I'm just pre-warning you. It's just because accreditation has read something and they say, we want more information. Not necessarily because we haven't done something that we should do. It's just that they want more information. So don't be surprised if you see that. In regards to when the site visit will happen, it'll happen in the spring. That date hasn't been organized. They will want to go ahead and see active sites, but I'll facilitate and organize all that with you guys related to that. If I've contacted you about needing certain policies and procedures or updates, please work on that and respond to that with that information of those documents. And if you need help with that, let me know because I'm here to help. All right. And then as I always do, I end with a learning tip. So the learning tip this week is called a 1-minute precepting. So this is kind of like a table associated with it. So 1-minute precepting is a learning technique that you can go ahead and implement into your preceptor. So the first thing is called get a commitment. So that would be asking your student, what would you do if I wasn't here? What decision do you want to make? All right. And then they would respond to that. The second one is probe for supporting evidence. So you would ask them, what factors are making you consider that decision? Why are you making that decision? What are you thinking about, or what are you considering? What are you discarding? So how are you making that decision? And then teach general rules is kind of a quick little mini lecture. So that could be like them answering, providing you, this is what I'm considering, that's how I made a decision. So you might have to give a quick little mini lecture. Well, I need to tell you about this, in order to give them more information. Or you might say, I think you need to look up additional information on that. Go read this article. Go reference that chapter in your book. Come back to me tomorrow. Or you need to learn more about that concept. So giving that mini lecture or some homework in order to go ahead and provide additional information. And then the other two, we have our reinforce what's done right and correct mistakes. So you always, and this is in general when we provide feedback, we want to tell them what they did right and highlight those things, and then we want to go ahead and correct mistakes. You did a really great job at selecting your goal and your intervention to achieve that goal. That was great. There was nothing wrong with that. But the way you applied that electrical stimulation or the sets and reps that you picked for that therapeutic exercise needs improved because you didn't address this, or you stated it was going to achieve this and it didn't, right? So those small kind of tweaks. So start with the positive reinforcement and then correct the mistakes. And we know in various aspects of life, often providing feedback in that manner is positive and receptive. So this model, this 1-minute precepting model, a lot of research and evidence has demonstrated that it's very effective in medical schools and with physicians that are being preceptors for medical students. And so it results in an increase in quality clinical experiences, and students are learning more and they're having better performance. So maybe take a shot, take a chance, implement our OPM, our 1-minute precepting technique, and see how that goes with your student. If you guys have any questions or need anything, as usual, you can always let me know. Thanks.